Dear students, today we learn about the artery supply of the lower limb. It is very simple, very easy. That lower limb is supplied by the branches of the femoral artery. Where does the femoral artery come from? Yes, it is the continuation of external iliac artery. Do you remember about the external iliac artery? Yes, the common iliac artery bifurcates at the level of the pelvic brim and divides into two branches. One is external iliac artery and another is internal iliac artery, isn't it? And when this external iliac artery crosses the inguinal ligament, it is termed as the femoral artery. Just like the flow of the river, if any river is present in two countries, then in one country it is called in one name, and when it crosses the border, then it is termed as other name, but the flow of water is same.
Suppose a river is situated both in India and Bangladesh. Okay, just see here. In the India, the name of the river is Ganga, but when it crosses the India-Bangladesh border, it is termed as the Podda.
Then at femoral triangle, this femoral artery will give rise many branches and terminate at two branches. One is the superficial femoral artery. Another is the deep femoral artery. This deep femoral artery is also termed as the Arteria Profunda femoris. There are some other branches also. One is the circumflex iliac artery. Another one is the inferior epigastric artery. Another one is the external pudendal artery. Okay, these are also the branches of the femoral artery. Now we will go down with the superficial femoral artery. This superficial femoral artery enters into the adductor canal and through the adductor hiatus it goes to the posterior compartment of the thigh and termed as the popliteal artery. I want to mention the adductor hiatus here. It is the lowest, largest opening between the adductor magnus and the femur.
Just look at here. This is the adductor magnus muscle, and here is the lowest, largest opening through which the superficial femoral artery will enter and goes into the posterior compartment of the thigh and termed as the popliteal artery. Just look at here. Here is the inguinal ligament, you can see, and beneath it, this artery, here this is termed as the femoral artery, but above the inguinal ligament, this portion is termed as the external iliac artery. It is the terminal branch of the femoral artery, that is the continuation is the superficial femoral artery, and here the deep branch, it is the Arteria Profunda femoris. Okay, you are looking that this artery is very much nearer to the femur, so if any fracture occur in the shaft of the femur, then it will injure the Arteria Profunda femoris and huge bleeding will occur at that time. Okay, now come here, that this is the superficial femoral artery. This artery will go to the posterior surface of the thigh or posterior compartment of the thigh through the adductor hiatus. Here the adductor hiatus will be situated and it will be termed as the popliteal artery. Here, when it comes into the posterior aspect of the thigh or the popliteal surface, this one is the popliteal artery.
Then this popliteal artery will divide into two branches. One is the continuation, that is the tibiofibular trunk, and another one is termed as the anterior tibial artery. And this thing happen at the lower border of the popliteus muscle, just opposite to the tibial tuberosity. And this anterior tibial artery will enter into the anterior compartment of the leg through the upper opening of the interosseous membrane. On the other side, the tibiofibular trunk will divide into two branches. One is posterior tibial artery and another is fibular artery.
Let's see that this is the popliteal artery. Okay, I'm looking through the vessels from the posterior aspect of the thigh and leg or the knee joint. So this is the popliteal artery. This popliteal artery will divide into two branches at the lower border of the popliteus muscle, and this area is just opposite to the tibial tuberosity. Okay, what are the branches? One is the anterior tibial artery, this one, anterior tibial artery. It will go to the anterior compartment like this. Here, through the upper opening of the interosseous membrane, this artery is termed as the anterior tibial artery. Okay, and this is the tibiofibular trunk, and this tibiofibular trunk will further divide into two branches. One is the fibular artery, the artery which will go alongside the fibula, the bone fibula, and another one is the posterior tibial artery. Okay, let's see about the posterior tibial artery. The posterior tibial artery will go to the plantar areas,
and this will happen just after 1 inch length of the tibiofibular trunk. This posterior tibial artery, it is then go to the plantar surface in between the medial malleolus and medial tubercle of the calcaneus, and there it will divide into two branches. One is lateral plantar artery and another is medial plantar artery. On the other hand, the anterior tibial artery will enter in the dorsal surface of the foot, midway between the two malleoli, and termed as the Arteria dorsalis pedis. And this Arteria dorsalis pedis will be felt in between two tendons. One is the extensor hallucis longus and another is extensor digitorum longus. And we can feel this artery in the proximal site of the first metatarsal space against the navicular bone. This Arteria dorsalis pedis gives four branches. One is the deep plantar branch, another one is the arcuate branch, another one is the lateral tarsal branch, and another one is the medial tarsal branch. On the plantar aspect, the medial plantar artery has two divisions. One is the deep branch and another is the superficial branch. This deep plantar artery, lateral plantar artery, and the deep branch of the medial plantar artery will form the deep plantar arch. And here the arcuate branch of the Arteria dorsalis pedis will complete its arc with the lateral tarsal branch. From the deep plantar arch, plantar metatarsal arteries will arise. And from this arc on the dorsal surface, the dorsal metatarsal arteries will arise. These arteries of the two surfaces are interconnected with the proximal perforating arteries. From the dorsal metatarsal arteries, the dorsal common digital arteries will arise. And from the plantar metatarsal arteries, common plantar arteries will arise. And the arteries of the two surfaces are interconnected with the distal perforating arteries. And ultimately, from the dorsal common digital arteries, dorsal digital arteries will arise, and from common plantar arteries, plantar digital arteries will arise. And this superficial artery will form the plantar metatarsal artery, along the grade 2. And these arteries ultimately anastomose with the venules of corresponding names.
Now we will see the plantar and dorsal surface of the foot. The posterior tibial artery will go to the plantar surface. Okay, we'll zoom it in. Okay, this one is the posterior tibial artery, clear? And it will give rise to two branches. One is the lateral plantar artery and one is the medial plantar artery. And the medial plantar artery has two branches. One is the superficial branch, here, this one, and another one is the deep branch, this one. Now we'll go to the dorsal surface and then again come into the plantar surface and we'll form an arch. We will hide the retinacula of the foot, extensor retinaculum. And now we can see the anterior tibial artery, isn't it? Yes. And here the anterior tibial artery will be continued as the Arteria dorsalis pedis. This one is the Arteria dorsalis pedis, this one. And you know that four branches will arise from the Arteria dorsalis pedis. One of them is deep plantar artery, this one, this tiny artery. Yes, this one is the deep plantar artery. Okay, this artery will go to the plantar surface and will unite with the lateral plantar artery and the deep branch of the medial plantar artery, and form the plantar arch, deep plantar arch. This is the deep plantar arch. Clear? From the deep plantar arch, the plantar metatarsal arteries will arise. These are the plantar metatarsal arteries. Okay. And here, this one is the arcuate artery. It is another branch of the Arteria dorsalis pedis. And this arch will complete by the union of the lateral tarsal artery. And from this arc, the dorsal metatarsal arteries will arise. These are the dorsal metatarsal arteries. And the metatarsal arteries of the dorsal surface and the plantar surface will be connected with two types of perforators. Okay, these are the proximal perforating arteries or branches, and here these are the distal perforating branches. Here is one, here is another, here is another. Okay.
Now let's go to the deep femoral branch of the femoral artery, and along with it we'll learn the anastomosis around the hip joint and anastomosis around the knee joint. The anastomosis around the hip joint is also termed as the anastomosis around the thigh. The deep femoral artery has three branches. One is perforating artery. There are four perforating arteries, and the perforating arteries have ascending and descending branches, and this will form the vertical anastomosis. Another branch is medial circumflex femoral artery, and it has the ascending, transverse and descending branch. Another branch is lateral circumflex femoral artery. It has also three branches. One is ascending, transverse and descending. The ascending branch of the medial circumflex femoral artery and the ascending branch of the lateral circumflex femoral artery, along with the superior and inferior gluteal artery, will form the trochanteric anastomosis. The transverse branch of the medial circumflex, lateral circumflex, the ascending branch of the first perforating artery and the descending branch of the inferior gluteal artery will form the cruciate anastomosis. This trochanteric anastomosis will form on the trochanteric fossa near the neck of the femur, and the cruciate anastomosis will form near the lesser trochanter and the intertrochanteric line. Now we will see about the popliteal artery. If this is the lateral side and this is the medial side, then this artery is named as the superior lateral genicular artery, and this one is the superior medial genicular artery. This one is the inferior lateral genicular artery, and this one is the inferior medial genicular artery, and in the middle this one is the popliteal artery. Okay, now look at here. The descending branch of the lateral circumflex femoral artery will join superior lateral genicular artery, and the descending genicular branch of the superficial femoral artery will join with the superior medial genicular artery, and another artery from the lateral side will join with the inferior lateral genicular artery, that is the anterior tibial recurrent artery, and thus will form the anastomosis around the knee joint. And another one is the circumflex iliac artery. It will anastomosis with the iliolumbar artery. It is the branch of the internal iliac artery. So, if you are my undergraduate medical student, just remember that lower limb is supplied by the branches of the femoral artery. Okay. The two major branches of the femoral artery are the superficial femoral artery, that is the continuation, and another one is deep femoral artery. Another name of it is Arteria profunda femoris, and it will give rise to three branches. One is perforating arteries, medial circumflex femoral artery, lateral circumflex femoral artery. There are four perforating arteries. Okay, and the superficial femoral artery will termed as the popliteal artery when it passes through the adductor hiatus and go to the posterior compartment of the thigh, and then the popliteal artery will give rise to anterior tibial artery at the lower border of the popliteus muscle and tibiofibular trunk, and from here the posterior tibial artery and fibular artery will arise. Okay, and the Arteria dorsalis pedis, that is the continuation of the anterior tibial artery, and it can be felt in between the extensor hallucis longus and extensor digitorum longus, and will supply the dorsal surface of the foot. Okay, another one is the posterior tibial artery, and it can be felt in between the medial malleolus and the medial tubercle of the calcaneus, and it will supply the plantar surface of the foot by dividing into two branches, that is the lateral plantar artery and the medial plantar artery. And here in the plantar surface a deep plantar arch will form, and in the dorsal surface the arcuate artery will complete an arc with the lateral tarsal branch of the Arteria dorsalis pedis. Clear? But if you want to be the vascular surgeon or the sonologist, then you have to know the other branches. Okay, and if you want to be the vascular surgeon, then you have to know the anastomosis also. One is the spinal anastomosis, another is the vertical anastomosis, another one is the trochanteric anastomosis, and another one is the cruciate anastomosis. And it is important for the undergraduate students to know the anastomosis around the knee joint, and you may have to draw and label the anastomosis around the knee joint.
Now I can show you that the branches of the Arteria profunda femoris. Here, this one is the lateral circumflex femoral artery, this one, and it has three branches. One is the ascending, another one is the transverse, and another one is the descending branch. Okay, these are the perforating arteries. Here is one perforating artery, another perforating artery, here is another one, and here is another one. And this one, it is the medial circumflex femoral artery. Okay, we can look at it from behind. This one, this is the medial circumflex femoral artery, this one. And the anastomosis will occur. One anastomosis, that is the spinal anastomosis, will occur at this region near the anterior superior iliac spine. The trochanteric anastomosis will occur at this region. Okay, and the cruciate anastomosis will occur near the lesser tubercle at this region. Now we will see the anastomosis around the knee joint. This is the popliteal artery, and it is the lateral side. Here is the medial side. So it is the superior medial genicular artery. Here is the inferior medial genicular artery. Here is the superior lateral genicular artery. Here is the inferior lateral genicular artery. And we will go in front. Okay. From here, we can see that on the medial side, from above, from the superficial femoral artery, one artery, that is the descending genicular artery, will come and anastomose with the superomedial genicular artery. And from the lateral side, from above, the descending branch of the lateral circumflex femoral artery. This one is the lateral circumflex femoral artery. Here, this one is the lateral circumflex femoral artery, and it is the descending branch. It will come down, passing a long way, and anastomose with the superior lateral genicular artery, that is the branch of the popliteal artery. And again, another branch come from the anterior tibial artery. Yes, this one is the anterior tibial artery, and from here, one recurrent branch of the anterior tibial artery will also come to form the anastomosis around the knee joint. And you can feel the pulse of the femoral artery here at the midpoint of the inguinal ligament and just below it, and you have to press just over the pectineus muscle and the superior ramus of the pubic bone or pubis. Okay. You can also feel the popliteal artery over the popliteal space or popliteal surface of the lower end of the femur. But make sure that the deep fascia here in this region remain flexed. Okay, that means you have to flex the leg at the knee joint before feel the popliteal artery. You can also feel the posterior tibial artery, where in between the medial malleolus and the medial tubercle of the calcaneus, okay, or in between the two tendons, that is the flexor hallucis longus and the flexor digitorum longus. And you can also feel the Arteria dorsalis pedis, where in the proximal first metatarsal space over the navicular bone. I hope you have enjoyed the artery supply of the lower limb and everything is clear to you. Thank you very much.